Hi, Mrs. Rossi. How are you?
Good, how are you?
Good. My name is Katie Dalton. I am a nurse practitioner student. I'll be conducting an interview and the complete head-to-toe assessment today. First, can I ask you what your age is?
32.
And do you identify as male or female?
Female.
And what is your ethnicity?
Caucasian.
Okay. And what is your reason for this visit today?
Just my yearly physical.
When was your last physical?
About a year and a half ago.
And what was the results of that visit?
It was normal.
Okay, good. How would you describe your current health status?
I'd say it's good.
Do you exercise regularly?
Yeah, I go to the gym about 4 times a week for like an hour.
How would you describe your diet?
I eat a pretty balanced diet.
And how would you describe your sleep?
I sleep good. I get like 7 to 8 hours a night.
How would you describe your stress level?
Pretty good right now. Really low.
And do you have any coping strategies to reduce your stress?
Going to the gym.
Going to the gym? Anything else?
No, the gym really helps.
Okay. For regular health screenings, do you go to the dentist on a regular basis?
Yes, every 6 months.
Okay. What about vision exams?
Every 1 to 2 years.
Do you have regular pap smears?
Yes.
When's the last pap smear you've had?
6 months ago.
And what was the result of that?
It was normal.
And do you perform routine breast self-exams?
Yeah, every month.
Now we're going to move on to your past medical health history. Are you taking any medication right now?
Just vitamin D, 1,000 units once a day. The D3.
How long have you been taking that?
About a year.
And you're compliant with taking that on a daily basis?
Yes.
Do you have any allergies to medication?
Penicillin. I got a rash.
Okay. Any allergies to food?
No.
And how about to the environment?
No.
Do you have any chronic illnesses that you're aware of?
No.
How about childhood illnesses?
Chickenpox?
Any hospitalizations?
No.
Have you had any surgeries?
Just my wisdom teeth when I was a teenager.
Okay. And in regard to your immunizations, do you believe your immunizations are up to date?
Yes.
To your knowledge?
Yes, for Zina.
Okay. Did you receive the flu vaccine this past season?
Yes.
Do you typically get the flu vaccine
I do.
yearly?
Every year.
Okay. What about the pneumonia vaccine? Have you ever had that?
No.
Have you had a recent tetanus vaccine?
Yeah, a couple years ago.
And to your knowledge, your childhood vaccines are up to date?
Yes.
You said you had a pap smear 6 months ago.
Mm-hmm.
Have you ever been pregnant?
No.
Okay. Any accidents or trauma?
No.
At all? Okay. And we're going to move on to your family history, so I'm just going to ask you a few questions about your family's medical history, as far as you know. On your father's side, your paternal grandfather, is he alive or deceased?
He's alive and actually pretty healthy.
Any medical history you're aware of?
No. Well, just my grandma, my paternal grandmother, she had a heart attack in her 70s and died.
Okay.
And my father has diabetes, type 2 diabetes.
Okay.
And then otherwise nothing on that side. And my mom just has high cholesterol. And my maternal grandmother, she had COPD. She died in her 70s. And my maternal grandfather died in a car accident when he was young. He was like 30.
Okay. And no medical history before he passed away that you know of?
Not enough.
And do you have any siblings?
I do. 2 sisters who are both healthy.
Okay. So no medical history on their part
No.
that you're aware of? Okay. Do you find your family to be a good support system?
Yes.
Can you identify any other support systems that you have?
I have a good group of friends.
Okay. What's your marital status?
I'm married.
Okay. What's your living situation look like?
I live with my wife and our dog.
Okay. Do you find that to be a safe environment?
Yes.
Okay. Do you have smoke detectors in the house?
Yes.
Carbon monoxide detectors?
Yes,
Do you always wear your seatbelt?
I do.
And do you wear sunscreen regularly?
Most of the time. I could be a little bit better with that. But
Okay. Okay, and do you work?
I do. I'm a nurse.
Okay. How would you describe your financial security?
It's good.
Okay.
Yep.
And are you sexually active?
Yes.
Do you have male or female partners?
Just
Or
my
both?
wife. I'm in a monogamous relationship.
Okay. Moving on, the next set of questions are we're just gonna do a review of your system, so it might get a little redundant. There's gonna be yes or no questions.
Okay.
Have you experienced any change in your weight recently?
No.
Any fatigue or weakness?
No.
Okay. Any fevers?
No.
Any headaches?
No.
Any changes in vision?
No.
Any blurred vision?
No.
Double vision?
No.
Any dryness or excessive teariness to your eyes?
No.
Okay. Any nasal congestion?
No.
Any nosebleeds?
No.
Any sinus congestion?
No.
Sinus headaches?
No.
Okay. Any mouth or tooth pain?
No.
Any ulcers in your mouth?
No.
Okay. Any ear pain?
No.
Have you noticed any drainage to your ears?
No.
Any changes in your hearing?
No.
Any pain or stiffness to your neck at all?
No.
Any, have you noticed any lymph node enlargement?
No.
Any masses around your neck?
No.
Has anyone ever told you you have a thyroid problem?
No.
Are you intolerant to heat or cold?
No.
Okay. Have you had any rashes?
No.
Have you noticed any suspicious skin lesions?
No.
Any changes in any of your moles or anything
No.
like that? Any itchiness to your skin?
No.
Any dryness to your skin?
No.
Okay. Did during your breast exams, did you find any lumps or any masses
No.
in your breast? Any pain to your breast?
No.
Any pain to your nipples?
No.
Any nipple discharge?
No.
Any cough?
No.
Any shortness of breath?
No.
Any shortness of breath during different levels of activity?
No.
How about in positional changes, like lying down, any shortness of breath?
No.
Any sputum production
No.
at all? Any pain during inspiration?
No.
Okay. Any chest pain?
No.
Has anybody told you that you had a heart condition?
No.
Has anyone ever told you had a murmur?
No.
Or high blood pressure?
No.
Or a blood clot?
No.
Okay. Any edema to your extremities?
No.
Any abdominal pain?
No.
Any diarrhea?
No.
Constipation?
No.
How often do you typically have a bowel movement?
Every day.
They're pretty regular?
Yeah.
Okay. Any blood in your stool that you've noticed?
No.
Any, when did you first get your menses, your first menses?
I was 12.
Are your menses regular?
They are.
How long do they last?
5 days.
Okay. Any spotting in between
No.
your menses?
No.
No. Any pain with intercourse?
No.
Any spotting after intercourse?
No.
Do you have any concerns regarding HIV or STDs?
No.
Okay. Any muscle stiffness at
No.
all? Any muscle pain?
No.
When you any limited range of motion to any of your joints
No.
or extremities? Okay. Any backaches?
No.
Any numbness or tingling feelings?
No.
Pins and needles?
No.
Have you ever struggled with depression?
No.
Anxiety?
No.
Any extreme mood swings?
No.
Any changes in level of alertness?
No.
Any tremors,
No.
seizures?
No.
Has anybody ever told you that you were anemic?
No.
Have you had any bleeding or clotting disorders?
No.
Have you ever had to have a blood transfusion?
No.
Okay. Before we move on to the physical exam, do you have any questions or concerns?
I do not.
Okay. So I'm going to leave you here with the gown to dress into, and I'll return in a few minutes.
Great, thank you.
Okay. The interview is now complete, and I will also note in the record that the patient is a reliable historian.